Depression is a hugely common problem in the UK and affects 1 to 6 people. However, people still feel embarrassed to talk about this depression, but why? Depression is as common, if not more common, than asthma, but people don't feel embarrassed to talk about that. Depression can happen to anybody, and in fact, a lot of people don't even know they have depression because it comes on so gradually. Luckily, there are a lot of effective ways to help stop this depression. The first thing to do is just make sure that you know you are depressed.
When someone's going through depression, they can face a wide variety of symptoms. For some people, they sleep too much. For others, they sleep very little or have broken sleep. Eating changes, again, can be two ends of the spectrum. It may eat to comfort oneself, or someone might completely lose their appetite. Lethargy, feeling really tired. And we're talking tired to the point of, things that you would do without thinking, like taking a shower, all of a sudden become really difficult to do. One of the things that I find interesting about depression is we always use that word, don't we? Oh, I'm depressed, I'm having a bad day. Real depression is about hopelessness and helplessness and just feeling that perhaps you can't see a way out. And those feelings, feeling very much of the here and now, but also the sense that they extend into the future. You may feel very alone. All of these symptoms can be attributed to depression. Lack of sexual appetite, fear about the future. But the point is that, and I believe this so strongly, a psychologist may be an expert in psychology, but ultimately you're the expert on you. So if you're feeling depressed, A, it's absolutely normal and nothing to be worried about, and B, there's so much help out there, and it's about educating the person that wants to help you.
It's really quite difficult to explain to someone that's never had depression how horrible and how bad it actually makes you feel. I suppose the best way that I can describe depression would be to say, imagine looking at life behind dark tinted glass. So everyone on the other side, like friends, your family, they all seem like they're enjoying themselves, they all seem happy and they're making the most of life, but to you, behind the glass, everything just seems dull and pointless. It's as though you're watching life and existing, but you're not actually part of anything. Another thing about depression is when it gets so bad, it makes you emotionally numb. You don't really feel anything at all. You don't get happy, you don't get excited, you don't love, you don't enjoy anything, even the sports and stuff that you used to do. You don't even really get sad. I mean, occasionally you might want to cry, but a lot of the time you can't even do that. When that used to happen for me, I used to just get really angry. Initially though, I didn't realise that I was depressed, or how badly depressed I actually was. Because my depression come on so gradually, sort of around a period of 2 to 3 years. It could have been even longer than that. I mean, all my friends and family would be saying I'd changed and that what's the matter with me, and I just didn't recognise it. I suppose it got to the point where I realised how depressed I was when I couldn't see the point in life. I wanted to die. It was as though life had no purpose.
If you recognize that you're depressed, I think the first thing to do is to share your problem. Now, this might seem easier said than done. We live in a society where everything but perfection seems to be taboo, from the way that we look to the way that we behave. Reality is, a huge proportion of the society in the UK and across the world are depressed. There's nothing to be ashamed of. We all get flus, we all get colds. In fact, depression is often called the common cold of psychology. The reason for that is because we live in very stressful times. So the point is that you need to try and help yourself get out of it. And if it's something that you can't do on your own, then asking for help is a huge part of coping. Sometimes coping is saying I can't cope and I need help.
You may get other symptoms like over-criticising yourself or exaggerating problems, but the main symptom is just thinking negatively. You may also get physical symptoms such as not being able to sleep due to thoughts rushing around your head, or sleeping too much and therefore being tired all the time. But don't worry, because there's a lot of effective treatments that can help to stop this and get you loving life again.
People can overcome depression through a variety of means. For some people, it's social support, getting that kind of, whether it's through friends and family, being able to talk about it. For others, it's by getting therapy, seeing a counselor or a psychologist. For others, it's through antidepressant medication that allows basically the brain's chemicals to be balanced, because so many times what we're feeling has a lot to do with how our brain is functioning. And for others, it's a combination of all three, which, you know, a lot of studies show usually has the best outcome.
You shouldn't put off getting help because you deserve to be happy and enjoy life. The psychologist will explain what you need to do.
I guess prevention is always the key, and I guess from a cognitive behavior point of view, the best way to prevent getting depressed is to try and keep perspective. For all of us, there's good days and bad days. For all of us, there's times where we feel that we can't cope. And what I say to my patients is use your toolbox. Some days, you know, a day's bad enough to warrant you talking to a friend or family member. Some days when things get really bad, it may be about going to a counselor, learning how to monitor thoughts or use relaxation or imagery. And other times, if it's very, very bad, it may be about going to your GP and talking about what medication you can get. But always know, and this is, I guess, paramount, that whether it's prevention or taking care of something, there's always people and there's always options out there. And the worst thing you can do is try and convince yourself that there's none.